Hello, I'm Skylar Newberry. I'm the CEO and founder of Biologics. I just want to start by telling you a quick story about how this company got started. My first job out of college, I worked in a laboratory called Elemental Enzymes. I had this coworker of mine that was same age, same group, same major, same classes, everything. And he got a cool project, which was, basically enzymes to degrade pesticides in the soil, really advanced stuff, really applicable to Missouri, where I'm from. Uh, Unfortunately, I ended up getting a project just after him, which was just a fish vaccine, which is not really quite as flashy or exciting, but that is actually the starting point for the company I want to talk to you about. So we are a pre-seed stage gene editing company pioneering a novel in vivo technology to basically train your immune system to remove toxic proteins. So everybody makes mistakes, even your cells. Every day, your cells synthesize about 1 million proteins, and in this process, they have to go from a long chain of amino acids to a very complex three-dimensional structure, and this is called protein folding. So when we age, things get a little slow, even our cells get a little tired. What happens is proteins start to misfold, and when they do, they can expose some surfaces that end up clumping together, forming very toxic aggregates. So some of the diseases that are related to this are Alzheimer's, Parkinson's, systemic amyloidosis. I don't know about you guys, but, quick poll. Does anybody know anybody that's had Alzheimer's before? Raise your hand. Yeah, it's a lot. It's about when you are getting ready to retire, you have roughly a 10% chance of getting it. It's really a quite tragic disease. So that's what we want to try to tackle here at Biologics. But in order to do that, we have to start somewhere basic. And with that, we have our first indication, cardiac amyloidosis, which is a devastating disorder. Basically, a protein that is misfolded starts to accumulate in the heart muscle. And what this does is it reduces your heart rate's performance, slows you down quite a bit, and just overall quality of life tends to drop. So when you have this disease, there's really not a lot of options. The current standard of care does not remove the amyloid fibrils. In fact, it's incredibly difficult to do so without causing more issues. So right now, the only options are stabilizers and silencing oligos. And honestly, it's kind of heartbreaking because you end up having to take this medication for the rest of your life, and it doesn't really get any better than that, unfortunately. So what we do is we've identified some antibodies that are able to bind and start to dismantle these amyloid fibrils in the heart muscle. We do this through what's called a next generation gene editing program. And here's the slide. We actually guide nature rather than overwrite it. We administer what's known as a lipid nanoparticle. I don't know if you guys have heard about the COVID vaccine, but yeah. We use the same kind of technology there, basically a lipid membrane that is able to target a very specific cell, the B cell, right in a narrow window when it's starting to rearrange its genes naturally. We act as just essentially a supplement to integrate itself into that whole process, basically forming a whole nanobody structure right on the end of antibodies. So we've already completed a proof of concept study in our laboratory. We started with AlphaFold 3, which is just a protein folding software, and we identified a single chain fragment that can bind to GFP, which is green fluorescent proteins. Sorry, I know this is getting a little sciencey, guys, but hang with me. We've actually been able to demonstrate visually and through a fluorescence-based assay the mechanism works. We can actually put in essentially any antibody fragment into your B cells in vivo. And due to the nature of B cells, we're actually taking advantage of what's called clonal expansion. So once we transfect one cell, it becomes many, and as you can see right there in that picture, it's not just one cell, it's actually a group of 5, 6, 7 cells. So how do we compare to other treatments? So we have gene therapy, which is not really a great fit for cardiac amyloidosis. There's up to 114 genes related. So at the cost treatment of about $1 million per, it doesn't really make sense. Chemical stabilizers and silencing oligos are the standard of care right now, costing about $500,000 a year, and again, don't remove the fibrils. Then we move on to monoclonal antibodies, which are still in clinic, but what this shows is that there's already antibodies and a lot of research already gone into this about how antibodies can remove these fibrils. But from our best guess right now, due to the clinical trials study design, is that you'll have to be on this medication for about 5 to 10 years for it to work. And I don't think that doesn't work with people's schedules. I mean, you have to go to a specialty clinic, you have to check in, sit at the infusion, and wait about 2 hours for the medication to take effect. Manufacturing considerations, just real quick. Since we are operating on clonal expansion, our dosage is extremely small, so our costs are also very minimal. So the cardiac amyloidosis market is about $10.5 billion and expected to double by 2030. But we want to use this as mainly a launching point to move on to other misfolded protein diseases like Alzheimer's and Parkinson's. Thankfully, the FDA has recently enacted some guidance, a 506K, that basically means if you get one approved product and the other products you want to get approved operate very similarly, it's a much more shortened clinical timeline. So in fact, we might actually be able to surpass a lot of other medications just trying to go for Alzheimer's, which can take 20 years. So it's kind of exciting. Our revenue models are essentially, the timeline is strategic pharma partnership, out-licensing. That's from 2026 onward, and also out-licensing and other things. Basically, we want to go into this upper echelon of biotech companies where we want to hit 100 million ARR by 2026, and that all of those companies that can do that are all platform-based. And then obviously our therapeutic sales after we get approved from the FDA. Our team is just a cacophony of people that love science. I have experience in immunology, clinical trial operations, and microbiology. I'm supported by an amazing advisory team with decades of experience. And the investment opportunity that we're looking for is a $500K pre-seed round. This will help us advance our product and de-risk our platform across the board. This includes CMC studies and a very pivotal mouse study. So, yeah, went over time a little bit, but thank you so much.
So can you talk a little bit about whether there's intellectual property or how you protect yourself, or what the secret sauce is here that gives this value to Bella Biologics?
Yes, so the mechanism and the delivery are both patent pending right now, so we have a little bit of time to finalize that intellectual property, but both of it is owned internally by us.
Great presentation there, Skylar. I was wondering your timeline to get this into humans, or what is kind of the clinical trial design in order to get that into humans?
Great question. So we're going to be going through what's called preclinical IND enabling studies, and this is going to take us all the way through the end of 2027. We're basically going to be going from mouse studies, immunogenicity, making sure that this is a safe product before it ever touches a human.
So this is a follow-up on the intellectual property question. Are other companies aware of this general approach, and they're trying to find their own approach to solve the same problem that you are, and you just have? I know I don't understand. I'm a different kind of engineer, so I don't understand the science. But
no. It's a great question. You're basically asking if there's any competing IP that's kind of close, or other people working on it.
Right, like, you use the example of the mRNA vaccines, right? And 5 companies came out with one, all kind of all at the same time.
Yeah.
And they all have their own patents, but it's all following the same general track because the idea of you can solve this kind of problem this way is out there. Is this the same kind of thing?
Right. So the basic idea of it is not being pursued by any other company. I don't think that a lot of people have considered this an option because basically the whole world is focused on CRISPR and other fun enzymatic ways to integrate DNA. They're looking for genes to fix. Where we differentiate is we're not trying to fix any genes. We're actually just trying to fix systemic problems. We're using a very modular system where we can integrate any antibody into B cells, and I just don't think anybody's tried that.